Kerala is battling a deadly outbreak of a rare brain infection caused by the so-called brain-eating amoeba. At least 69 confirmed cases of primary amoeba meningococcus capitalis has been reported in the state this year, with 19 people losing their life. The disease triggered by Naegleria fowleri has set off alarm bells for health authorities and the public alike. While rare, PAM is among the most lethal infections known, with a global mortality rate of around 97%. In Kerala, however, health officials note that the mortality rate so far is 24%, considerably lower than the international figures. So, what exactly is this infection? Why is it so deadly and what can be done to prevent it? Let's get to know. What is PAM? PAM is acute rare brain infection caused by Naegleria fowleri, popularly known as brain-eating amoeba. The organism is a free-living amoeba that thrives in warm, freshwater bodies and soil. It is often found in lake, ponds, river, hot spring, poorly maintained swimming pools, splash pads, and even in untreated water storage tanks. Contrary to common fears, people cannot get infected by drinking contaminated water. The amoeba only infects human when it enters the body through the nose, typically while swimming, diving, or when water forcefully enters nasal passages. From there, it travels to the brain, where it causes inflammation and destruction of brain tissue. The US Centers of Disease Control and Prevention classifies it as one of the most aggressive and fatal infections, often striking otherwise healthy children, teenagers, and young adults. Why is it called the brain-eating amoeba? The term comes from the way Naegleria fowleri attacked the brain. Once inside, the amoeba consumes brain tissue, causing severe swelling, cerebral edema. Now, this rapidly leads to neurological deterioration, coma, and in most cases, death. The infection progresses so quickly that the time it is diagnosed, doctors often find themselves in very limited treatment options. The symptoms typically appear 5 days after exposure, though they can occur as early as 1 day or as late as 2 weeks. Early symptoms mimic meningitis and include severe headache, high fever, nausea, and vomiting. As the disease advances, neurological symptoms develop, such as stiff neck, confusion and disorientation, loss of balance, seizures, hallucinations, coma. According to Kerala health officials, most patients present late, by which time brain swelling is already extensive and treatment becomes far less effective. Can it be treated? There is no standard treatment for PAM. Globally, doctors have experimented with a combination of antimicrobial drugs such as amphotericin B, remifene, azithromycin, flumazenol, dexamethasone, and the newer drug methotrexate. Even with aggressive treatment, survival remains extremely rare. The CDC notes that the most patients die within 1 to 18 days after the onset of symptoms, usually slipping into coma around the 5th day. Notably, nearly all survivors over the past 6 decades were diagnosed before the infection spread extensively to the brain. This highlights the importance of early detection and immediate treatment. Kerala's situation. Kerala Health Minister Veena George has confirmed that the year's cases are sporadic and scattered across districts, unlike last year when clusters were linked to specific water sources. This has complicated epidemiological investigations. The investigations have affected individuals ranging in age from 3 months to 91 years, with a higher number of male patients 33 compared to female 19. Health authorities have launched environmental samplings of water sources, while the National Center for Disease Control is assisting in investigations. Hospitals have been placed on alert, and public awareness campaigns are warning citizens to avoid swimming in untreated or stagnant freshwater bodies. Why Kerala? Cases of amoeba meningococcus has been recorded in Kerala since 2016. Experts suggest that the state's warm, humid climate and abundant freshwater bodies provide an ideal environment for Naegleria fowleri. With rising temperatures, such as pathogens may become more common in tropical and subtropical regions. However, health officials stress that while the disease is deadly, it remains extremely rare relative to other infections. The focus, therefore, is on prevention and vigilance. How to stay safe? Avoid swimming or driving in stagnant water, fresh water during hot weather. Use nose clip or avoid getting water up to the nose while swimming. Ensure proper chlorination of swimming pools. Do not use untreated water for nasal cleaning. The rise in PAM cases in Kerala is a public health concern, but also a reminder of the lurking risk in untreated water sources. With no reliable cure available, prevention and early diagnosis remain the only effective strategies. As Kerala ramps up awareness campaign, health authorities are urging citizens to stay cautious, particularly when engaging in water-based activity. While the infection is rare, its highly fatality rate makes it one of the most feared waterborne diseases worldwide. That's all for now in this update. Stay tuned to the Savera, download the app and follow us on your social media platforms.